everyone, welcome to my YouTube channel. I am going to upload the whole syllabus of anatomy including upper limb, lower limb, thorax, abdomen, pelvis as well as CNS. So I have already started with the lower limb session. Our today's topic is popliteal artery. We will be learning popliteal artery in 4 subtopics, that is its beginning, course and termination, its relation, its branches as well as clinical anatomy. So let's begin. Popliteal artery is the continuation of femoral artery. The further continuation of femoral artery is called as popliteal artery. So it begins where the femoral artery ends. That is in the opening in the adductor magnus, or also called as hiatus magnus, which is located at the junction of middle 1/3 and lower 1/3 of thigh. It runs downwards and slightly laterally reaches the lower border of popliteus muscle and terminates by dividing into anterior and posterior tibial artery. It has a short course. It begins at the opening in the adductor magnus, then runs downwards and slightly lateral to the lower border of popliteus, and then terminates by dividing into anterior and posterior tibial artery. Its relation: anterior or deep relation, posterior or superficial relation, lateral relation and medial relation. So anterior or deep relation: popliteal surface of femur, back of the knee joint, fascia covering the popliteus muscle. Posterior superficial relation: tibial nerve. Lateral relation: biceps femoris, lateral condyle of the femur in the upper part, plantaris, lateral head of gastrocnemius in the lower part. For this I have a short mnemonic called as BPL2. B is for biceps femoris, P is for plantaris, L is for lateral condyle of femur in the upper part and lateral head of gastrocnemius in the lower part. Similarly, in medial relation, we have medial head of gastrocnemius in the lower part, medial condyle of the femur in the upper part. Along with it, in the upper part we have semimembranosus, and in the lower part we have tibial nerve and popliteal vein. Its branches: it has 5 genicular branches, 2 superior, 1 middle and 2 inferior. 2 superior genicular branch: superior medial genicular artery, superior lateral genicular artery, inferior medial genicular artery, inferior lateral genicular artery and middle genicular artery. It also has muscular branches, upper 2 or 3, which supply the adductor magnus and the hamstring muscles. It terminates by anastomosing with 4th perforating artery. Lower or the sural branches: soleus, plantaris and gastrocnemius. Cutaneous branches directly or indirectly from the popliteal artery, one of which accompanies with the small saphenous vein. So altogether we have 5 genicular branch, 2 or 3 muscular branch, 1 lower or sural branch and cutaneous branch. Clinical anatomy: popliteal artery is used for recording the blood pressure. In coarctation of aorta, popliteal pressure is always lower than the brachial pressure. Coarctation means the narrowing of a greater vessels, in which the popliteal pressure is found to be lower than the brachial pressure. Constant pulsation of artery is felt against the tendon of adductor magnus, may cause changes in the vessels leading to the narrowing and occlusion of artery, can cause damage, gangrene up to the knee, which is prevented by the collateral circulation through the profunda femoris artery. So this was all about the popliteal artery. I hope you understood the topic. If you want such more videos, you can subscribe to my channel. Thank you for watching. Is there any query? Do comment in the comment section.